next we're going to access and de-access the port. Of course, we always want to explain the procedure to the patient as well. We want to gather our supplies, check the expiration date on it, always adhere to general safety practices, and check the doctor's orders that he wants it to be implanted. So, always put on proper PPE, your gown, your mask. I'm going to ask the patient to wear a mask or have them turn their head to the opposite side that I'm working on, and the visitors as well, have them wear a mask or step out. So first we're going to perform hand hygiene, and I'm going to put on clean gloves so that I can inspect the site. So I have my clean gloves on. I'm going to inspect it for any signs of infection or irritation. And then I'm going to gently palpate to see where I need to put the access device. So I found it there, so I'm going to dispose of my gloves, and then I'm going to set up my sterile field. Okay. So I'm gathering my supplies and check the expiration date. A mask for my patient, but they're already wearing one. And my sterile gloves that I need. So now we want to clean this side vigorously for 30 seconds. I'm going to take my water prep and I want to make sure not to go over my sterile field, but I want to clean this side for 30 seconds. From the center to the outside. Okay, so I'm going to dispose of that. I'm going to allow that to dry. I'm going to clean this. You want to make sure that you flush this with saline to prevent any air from getting into the site. You don't. So we're going to flush it if it's not pre-filled. Okay. We're going to leave this attached so that we can aspirate and check the blood return. So I'm going to put my finger in the center while holding the wings of this. I'm going to take my non-dominant hand and we're going to push this in a 90-degree angle until it is flush with the skin. Okay. So now that that's in, we want to aspirate about 3 to 5 milliliters of blood. Make sure that it's in there, and then we're going to flush it again. You want to apply a Kuros cap to this so that nothing can get inside of it. And then we are ready to apply skin protectant around the outside of it. And we're going to apply a dressing. You want to date it and time it and put your initials. Okay. So we have accessed the port. So we've aspirated and we've checked placement. We've applied a Keros cap. If the patient was on like an IV infusion, you could hook them up to that. So that is it for the sterile procedure. So we're going to dispose of our supplies and then we're going to deaccess. So to deaccess the port, you want to make sure you follow the same procedures as far as your PPE and the patient wearing their mask and turning their head. You want to get an order from the doctor to make sure that that's what they want, is to take it out. So then you want to make sure that your area is clean, and then we are going to apply clean gloves, perform hand hygiene, and then put on your gloves. So we can take this dressing off. Just careful not to touch the center, the direct center of the port. We're going to inspect again for infection or irritation. We're going to dispose of that dressing. If the patient was ordered a heparin lock, they could be ordered heparin or saline lock. So we'd want to flush it with heparin or saline as ordered, whatever's ordered. You can always aspirate as well. You want to clean this side before you do that. And then we're going to flush with whatever's ordered. Okay, so now we're going to clamp it after we've flushed it. We want to clean this side as well too, with an alcohol swab before we take it out. So clean that. So then we're going to hold this. We're going to pull the needle out so that's in the safety hub. Then we're going to dispose of this in the sharps container. So then we could also, we're going to clean this side again with alcohol, just to make sure it's clean. It's such an important site because it's so close to the heart, so we always want to make sure that everything is clean and sterile. So I've got that clean, we've allowed it to dry, and then we're going to apply a dressing. So you would apply this with some tape. Okay. So to give medication through a port. So I would change my gloves, then put on clean gloves. But to change the medication, or to put medication through the port, we always want to adhere to 11 routes of medication administration. We want to check it with the MAR, getting out the Pyxis, check it at the bedside with the patient. We want to make sure that it's compatible, check for compatibility, and of course check the doctor's orders. So we want to flush. We want to clean this port vigorously for 30 seconds. And we're going to aspirate and flush first. So we can aspirate for blood, make sure we're still in the correct spot, and we're going to flush it. Then we're going to get our medication. And we're going to give this at the prescribed rate. And we're going to flush again. Okay, and then we would apply Kuros cap, or if they were getting hooked up to an IV, we would, or if they were getting continuous IV, then we would hook them back up to that. And then we would clamp this back off. So, that's it for med administration and central line. Thanks.